Dr. Gayle Dean, March, of course, is DVT Awareness Month. How common is DVT in pregnant women?
Actually, DVTs occur about 0.5 to 2 out of 1,000 pregnancies.
Okay.
Pretty rare. However, when they do occur, the risk of getting a pulmonary embolus, which is a loose DVT, results in being the highest risk of mortality in pregnancy,
Okay.
or the cause of death for pregnant women.
Sure. What are some of the symptoms, and at what point should a pregnant woman get to the hospital?
So things that we look for are, number one, swelling on one side greater than the other, tenderness, pain, and or redness. Now it also is common that a DVT occurs more commonly on the left side than the right side, about 80% to 20%.
Oh, interesting. Because I know with pregnant women, they kind of swell everywhere,
Yeah,
they get
exactly.
cankles, but this is
Exactly.
a very obvious one is bigger than the other.
Exactly. One is typically bigger than the other.
Okay.
Because typically it's going to be on one side versus the other. The other side that's not affected is normal.
Okay.
And the side that is affected will be swollen, tender, and maybe red as well.
Okay. Let's talk about prevention. How can expectant mothers prevent DVT?
Well, a couple things that you can do that are within your control. Number one is being active, because one of the risk factors for developing DVT is actually stasis, or not moving around a lot. So being active, exercising, and as well as not smoking, controlling obesity, those things are things that are within your control. And if you have, for some reason, let's say you're on bed rest, which some women are, then a lot of times we recommend using some compression stockings to help the vascular flow move upwards and not be static on the lower extremity.
Is this something that pregnant women should be especially concerned about, or just keep it in the back of your mind in case one of your legs swells up someday?
I think it's something to keep in the back of your mind in case one of your legs swells one day. It's not a very common phenomenon, as we just discussed. However, when it does occur, there's some concern for it because of the significant risk associated with it.
Sure. And the risk to the baby as well?
And the risk to the baby being the fact that if a woman develops the DVT, and gets a loose component of the DVT, an embolus, can go to the lung and can cause immediate death of the mom. Also be cognizant that it's not just during pregnancy. It can occur anytime during pregnancy and actually 6 weeks postpartum. Women that are pregnant are about 5 times greater chance of getting a DVT than the average woman.
Dr. Gayle Dean, thank you for your insight.
Thank you.
Appreciate it.